Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer. Excerpts today from a roundtable about the pandemic mental health services picture here in Connecticut, beginning with the Commissioner of Mental Health and Addiction Services, Miriam Delphin-Rittmon.
And good afternoon, everyone, and welcome to our virtual roundtable discussing mental health and family services during the COVID-19 pandemic. I'm so pleased to be able to be joined by Governor Lamont and also Commissioner Durantes, and we have two of our community providers that are here that will introduce themselves and also share about their work as well. I do want to start by just talking a little bit about, first of course, by thanking Governor Lamont for your leadership and for your steady hand throughout this pandemic. I have so appreciated that state agencies that we've been able to meet regularly and have discussions around what our overall response is. So appreciate your leadership. One thing that we've talked about, and Governor Lamont, you've stressed this as well, is just how important it is to pay attention to mental health. And so, one thing that has been part of many of our discussions is just that, COVID has been, it's been a challenging time, an unprecedented time. And in fact, many people were now, 9 months in, and many people often talk about the COVID fatigue that's setting in, or families talk about the fatigue and stress associated with the economic uncertainty, or this just the stress of not being sure about their own health, their family members' health. And so there's a lot that collectively we're holding and experiencing together. And so I appreciate this conversation as it's an opportunity to talk about resources and supports that are available. One thing certainly that I want folks to know is that there are services and supports available if people are struggling. If you're struggling, certainly do reach out because, again, help is available. Just a few resources that I would like to share that DEMAS has in place. We were lucky to be funded by FEMA and SAMHSA. We have an initiative called the COACH Initiative. It's COVID-19 Assistance for Community Health. That is available on the CT Stronger website. So that's ctstronger.org, or also through 211. 211 can connect folks with the COACH resources. And 211 is another really valuable resource that I want folks to know about. By calling 211, a person can be connected to our mobile crisis services and supports really across the lifespan. I know Commissioner Durantes will talk about this as well as other services and supports that are available. We have hotlines for young adults. There are resources in the state available for parents that may be struggling, resources related to food availability and food resources. So 211 is just a wonderful hub to be able to get information around a range of needs to include mental health and addiction services. We also have a 1-800 number associated with individuals who may be struggling with addiction. That's 1-800-563-4086. Again, 1-800-563-4086. And that's our access line. And essentially that line will connect a person to really a live person. They can receive an assessment over the phone. And if they need a ride to detox, we'll come and pick them up and give them a ride to detox, even through COVID. So with appropriate PPE, with a larger vehicle, we'll give people a ride to detox if that's necessary. So those are just a few resources that are available that I wanted people to know about. Because again, what we're hearing is the fatigue of COVID is challenging. And we know during the holidays, the holidays can bring up stress as well. And so again, there is support and there is help available if people are struggling. I do want to go ahead now and introduce our first speaker, who will be Tyler Booth. Tyler is the Chief Operating Officer at Intercommunity. Intercommunity is a federally qualified health center located in the Hartford region. They provide a full range of services and supports. And so, Tyler, I'll turn it over to you now to go ahead and introduce yourself and speak about some of what you're seeing and what Intercommunity has been offering throughout the pandemic.
Great. Thank you very much. Again, my name is Tyler Booth. I'm the Vice President and Chief Operations Officer for Intercommunity Healthcare. We are an agency that has 3 different clinics, one in East Hartford, another in Hartford, and a third in South Windsor, in addition to 7 different school-based health centers that are all located in East Hartford. I don't want to talk too much just about intercommunity services, but more talk about kind of the services that are available to anyone, regardless of their age or demographics. We do run the largest detox in Connecticut, though, and are part of, as the commissioner talked about, their regional transportation. So one of the things that intercommunity and DMIS have worked very carefully around is to make sure that people who need to start services can do so in a very safe manner. So we've made sure that even how detox transportation occurs, that's much more localized, so people are in the car for smaller amounts of time. There's a lot of PPP that is being used, so we have that important safety aspects. Whether you are dealing with a substance use disorder or feelings of isolation or trauma or anything else that might be going on in your life, high blood pressure, there are agencies such as Intercommunity that are available to start you with that care today. And if you do not feel comfortable leaving your home, you can do that through telehealth. One of the very important things that the governor did was expand our telehealth services so that it can include telephonic support and can include the very first contact. So if people are in any way concerned about leaving their home, but they know that they can't continue to be isolated, you can pick up the phone and call the numbers that the commissioner talked about. You can call Intercommunity's number or any of the other providers, and they should be able to help you that very same day that you call with some sort of telehealth or a connection to an agency such as mine that can see you in person or via telehealth that very same day. We have seen a kind of vacillation of requests for services. There's certainly many people who are feeling in need. We're seeing a higher number of people with alcohol use disorder coming into our detox areas. And then we see kind of dips again as the kind of infection rates seem to grow, or people get a little more nervous about how to get that help. That's why I want to urge folks to really use the telephonic support, use that telehealth if they're in any way concerned about their own safety. We and other agencies, as I said, do provide in-person, on-site, same-day access in addition to our telehealth services. Another thing that we've really been trying to watch carefully is the impact that folks have with their physical health and how that connects to mental health. Many agencies such as mine provide what we call whole person healthcare. So when you are calling about any issue whatsoever, one phone number is all that you need to be able to have a full assessment of what's going on in any aspect of your life, and we can then connect you with the right levels of care. Intercommunity in particular offers multiple levels of substance abuse recovery supports, including residential care. It's been interesting during the COVID-19 pandemic, there's been a decrease in demand for people to come into those multiple levels of care. I think folks often feel a little bit anxious about going in and living with someone for a period of time. But what I can say, knock on wood, continued, that we have not had a single transmission within any of our programs for COVID-19 that includes our primary care, that includes our detox, that includes our residentials. So it really is a safe environment, and my agency and others are really being cognizant of how to make sure that we can provide care in a safe environment.
Thank you so much, Tyler. I appreciate that. And I appreciate that you mentioned telehealth. I think that's a really important thing for folks to know about, that, you know, if they're not able to leave their home or if they're hesitant, then they can still connect with a provider through telehealth services and supports. Again, through our providers across the state. So that is really, really valuable resource. And again, thank you, Governor, for your leadership. And there have been loosened regulations around some of the, telehealth. So it is a nice opportunity for an individual to connect either via phone or other video measures as well.
The Commissioner of Mental Health and Addiction Services, Miriam Delphin-Rittmon, chaired today's broadcast excerpts courtesy of CTN. For further information, call us at 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of the station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from 104.9 WIHS.